Hi everyone, my name is Kelly and I am with Back to Me Therapy. I am an occupational therapist, an OTD. People ask why occupational therapy, and most of the primary care doctors don't really understand it, they don't refer it, but I'm here to kind of clarify the importance of what occupational therapy offers. I'm going to focus first on a series of pediatric concerns and then moving across lifespan. I currently treat across lifespan, so I treat from pediatrics to older adults. So occupational therapy, what sets us apart from other therapies? It's about function. It's about what you need to do and what you want to do and how we can get you there as independent as possible. So a common question I get is why occupational therapy? So my journey began as a second career. I was a mother of 3, and I actually was taking a friend to rehab for physical therapy, and I thought, oh, let me look into this. And then as I was taking her week after week, and I was like, there was this little station, I'll never forget, set up in the corner. I'm like, what is that back there? It was these creative ways to work on fine motor. And I was like, and someone said, oh, that's occupational therapist. And I'm ashamed to admit, being an occupational therapist, that I was like, what's that? And the more and more I researched, I said, I'm on the wrong path. And I pursued occupational therapy over physical therapy. And I am so glad that I did. My journey was long, but it was worth it. And what I found was when I really started researching about what we have to offer and the multifaceted style of helping people was, it really kind of blew my mind away, because I thought, wow, we belong everywhere, like primary care, oncology, burn victims, chronic pain, chronic disease, neurodegenerative, of course, peds, people are familiar with. And the more I started really researching, I was like, wow, this is an amazing field. How far can we take this? And unfortunately, despite having a doctorate degree and being a doctor of occupational therapy, I'm still fighting to advocate in my own practice to get doctors to write referrals or insurance to cover services, because they just don't understand. And I even know, having a conversation with my own primary care doctor, when I spoke to him and educated him in all the ways that occupational could help his clients, he said to me, wow, I didn't know occupational therapy could do that. So I think why back then, when I saw this little station of creativity, it was nothing I had ever seen before. And I thought, wow, that's pretty interesting. And the more, again, that I researched about it, I realized this is an amazing field, and how can I be a part of it? And every day I get up and I am so grateful that I get to do what I get to do. And it's not always big gains. It comes in peaks and valleys, especially since I treat across lifespan, which means pediatrics and older adults. But it is fulfilling, and it is really a profession and a genre of therapy that is really unlike all the therapies out there. We're in mental health, physical disability, again, neurodegenerative. So seeing these clients that are feeling hopeless and feeling like they can never return to any source of normalcy, that they can not function the way they once functioned. And that may be true for some, but it's my job to come in there and say, we're going to get you there as far as we can, and we're going to work to improve your quality of life and provide you with increased confidence, increased function, and increased independence. So what I offer you today is just an introduction of letting you know future things to come. But again, it's a holistic approach. We look at the individual, not the diagnosis. So I hope that you come with me on this journey and explore occupational therapy throughout lifespan with me.